Some changes made by the Department of Health in the Eastern Cape after the Minister of Health, Dr. Zweli Mkhize's visit to the Nelson Mandela Metro this week. During his visit, it became evident that the province was ill-prepared to deal with the rapid rise in COVID-19 numbers, with the minister going as far as saying that the figures in the metro did not add up. In a bid to flatten the COVID-19 cases in the Eastern Cape, MEC Sindiswa Gomba has now tried to ensure the allocation of resources to the Nelson Mandela Metro. The metro is the epicentre of the virus in the province, with 194 infections. Let's get more on this. We cross to our reporter Lerato Fekisi in Port Elizabeth. Very good afternoon to you, Lerato. It seems that there's a scramble to try and fix the problems that may have been identified by the Minister of Health a little bit earlier.
Well, the MEC of Health in the Eastern Cape, Sindiswa Gomba, has definitely hit the ground running now to try and undo perhaps the mess that they've created with what the minister was saying, perhaps a lack of preparedness in terms of dealing with this virus. What she has done right now, as of yesterday, she has employed about 57 professionals, and also additional nurses are going to be enrolled and taken to various hospitals around the Eastern Cape. Additional to that, Nzinga, she has also added 15 vehicles to conduct more screening, testing of people at various areas, particularly the rural areas of the Eastern Cape. We have also seen her getting from the National Department of Health gloves, masks, N95 masks, which are crucial at hospitals, and also making sure that in terms of every single staff has got the correct protective gear as they're now the frontline workers in fighting this pandemic. You remember that, Nzinga, just about 2 weeks ago, a hospital here in PE, which is placed in the township area of PE and really accommodates that area, the nurses there actually downed tools, saying that they refuse to work until they get the right protective gear. So that they have been answered. And also another hospital in Glenvale here in Eastern Cape was also protesting over the same issue, but they have also now been answered and also get the right protective gear to fight this pandemic, which is currently sitting at 417 cases here in the Eastern Cape.
Been able to find out from people perhaps working in the health sector in the Eastern Cape, in particular in Port Elizabeth, if there's happiness with this movement and there's a sense that something is actually being done now and they can feel it?
We actually got an anonymous call yesterday from one of the nurses at one of the hospitals in Livingston Hospital, which actually has been earmarked and actually been stated to be a quarantine hospital. And she said that, you know what, and I quote her, that really the arrival of the minister in this province and perhaps the broadcasting of the SABC of the minister's arrival was literally the light at the end of the tunnel. She said, I don't know what you guys did to wake these people up, but since you guys broadcast the minister's arrival here and perhaps his lack of satisfaction with the department here, they've seen posts that were vacant for over 20 years being opened. They've seen PPEs come to nurses. Nurses were struggling with the basic things such as a mask. They had to fight for a mask because masks were being stolen within the same vicinity. So all of a sudden now vacant posts are being opened, and PPEs, which was a struggle for many years even before the coronavirus, are now being made available. So the staff saying perhaps the minister's visit was perhaps a visit from a guardian angel to help these people who are trying their hardest to fight this pandemic as frontline workers.
Lerato Fekisi in Port Elizabeth, giving us an update on what's happening in the Eastern Cape, in certain parts of the Eastern Cape, when it comes to trying to fight the COVID-19 pandemic.